this video we'll be discussing on the topic of our urinary bladder. So we'll be seeing the anatomy of urinary bladder as we have continued from the ureter. So watch the video of ureter, I have uploaded that. So we will now move on to urinary bladder. Okay, now urinary bladder is an organ which stores the urine, you know that, and it is a muscular organ, muscular reservoir of the urine. Okay, and it is present in the anterior part of the pelvis. Okay, so the meaning is that it will be present on the anterior part, means the pelvis, with respect to pelvis, it will be situated in the anterior region. Okay, now if we talk about the difference between the location of the bladder, in males they are situated in the anterior part of the lesser pelvis, and in female it is present in front of the uterus. Okay, so this is common actually. The anterior part of the lesser pelvis, it is same for both male and female. The main difference occurs is that in male it is present in front of the rectum, that is rectum will be present posterior to the bladder, but in case of female the uterus is present, means uterus is present behind the bladder. So in the case of female, uterus is behind, and in the case of male, rectum is behind. So another language, front of rectum in male and front of uterus in female. So this was the situation, that is a location where it is situated. Now when bladder is empty, so bladder is present in two forms, so it has different shapes also, because when the bladder is empty, no urine is present, then the shape will be different, and when the bladder is full, or which is called as distended, then the shape will be another shape. Okay, so we will be seeing the shape also. So when the bladder is empty, that is no urine is there, then it lies in the lesser pelvis. But if the bladder becomes distended or it is filled with the urine, okay, so it expands upward. Meaning is that the bladder will now expands upward and forward into the abdominal cavity. So the line is saying that the bladder will extend in the upper part in the abdominal region, that is the above the pelvic part. So from abdomen the pelvic continues, so the upper part of the bladder will go into the abdominal region because of the fullness of the bladder, or you can say distended bladder, when the bladder is full. So in the children it does not actually happens in the early age. In children it lies actually in the abdomen and pelvic organ, abdominopelvic region actually, and even when it is empty. Okay, so even when it is empty or full, it lies actually in the, some part is in the abdomen, upper part is in abdomen, and lower part is in the pelvic region. Neck of the bladder lies above the level of the upper border of the pubic symphysis. So neck actually lies above the border of the pubic symphysis. Pubic symphysis, the bone, you know, the part in the iliac bone. So this bladder, the neck of the bladder, will be seeing the anatomy just after this theoretical discussion. So it will present above the level of the pubic symphysis in the case of children. And normally, I have told you, and after the age of puberty, you can say the pelvis actually enlarges. So because of that, then the bladder actually comes inside the pelvic region when it is empty, and some part goes inside the abdomen when it is distended or filled with urine. Okay, now capacity, if we talk about capacity, it has 120 to 320 ml normally it can store, means it is the safe volume for the bladder, and mean volume is 220 ml when the desire actually comes to maturate, and we can maturate around 250 to 300 ml. So it is the means you can say normal range for maturation, but desire actually starts at the level of 220 ml. Clear this much. Now tolerable range is 500 ml, means you can voluntarily control the urination or maturation, but if the level goes above this 500 ml or till about 800 ml, then it is beyond one's control. So it is not under our control when it exceeds this 800 ml. Clear this much. Now if we talk about the external features and relations of the bladder, so feature relations we will seeing in the next part. In this video we will be seeing the features, actually external features. So shape, okay, now shape, as I told you, when the bladder is empty, when it is not filled with urine, the shape is actually tetrahedral. Okay, so shape is actually tetrahedral and ovoid when the bladder is full. So these are two shapes you will see when the bladder is in different form. Now external features, we have first apexes will be externally what we will see: apex, base, neck of the bladder, three surfaces will be there, and the four borders. Surfaces will be the superior and 2 inferior lateral surface. Okay, superior and 2 inferior lateral surface. Clear? And 4 borders we have is the anterior and the posterior and the 2 lateral borders. So these are the 5 external features you will see in the bladder. So now I will show you some diagrams. Okay, on the diagrams I will show you some situations and the locations of the bladder. So in this diagram you can see, as you can see in this diagram, as I told you that the bladder is situated in the anterior part of the pelvis. So you can see this is abdominal wall, anterior abdominal wall, and this area is the pubic symphysis, and this region is abdomen. Clear? And you can see this is bladder. So bladder is actually situated in the anterior part of the pelvis. So it is this area is anterior and this is the posterior. In posterior you can see the rectum is there, then vertebra, then the most last part the sacrum, and somewhat seminal vesicles and coccyx, and all this are present. Okay, so the meaning is that it is situated just on the anterior aspect of the pelvic region, pelvis. Clear? So this is the diagram for the location of the bladder. Okay, so in females, as I told you, in males, as I told you, the rectum will be present. So meaning is that in front of the rectum it will be present. In front of the rectum it will be present in males. In case of females, here the uterus will come. So because of that uterus, the bladder will be present in front of the uterus in the case of female. In the male, it is present in front of the rectum. Clear? Now let's move on to the parts. On this diagram you will see it will be clear more. Now as I told you, on the apex we have, apex is the most anterior part, you can say anterior superior part, apex. So it provides attachment to the median umbilical ligament. This is a ligament, this is the obliterate ligament, urachus of the embryo. So after the birth there is urachus inside the embryo, okay, through which the feeding is done to the baby through the mother placenta. So after the pregnancy or after the birth, this median umbilical ligament is the obliterated part of that urachus of the embryo. So it is actually joins, or it originates from this region, median umbilical ligament. Clear? From the apex, and apex actually lies posterior to the upper margin of the pubic symphysis. So it is present on the posterior side of the pubic symphysis in the upper margin. So the location is that pubic symphysis will be like this. So on the back side of the pubic symphysis and the upper part of the pubic symphysis it will be present. Okay, so you just consider these are the pubic symphysis, the joint. Okay, clear? So apex is this part is your apex. Now comes your base. So base is actually called as fundus, or with respect to surface, it is also the posterior surface of the bladder, posterior surface. Clear? So I will show you on this. So this is the superior lateral angle. So this is the superior part. So just we will label the first of all the parts. So this is actually the superior surface, you can see this superior surface here. Okay, and these are the sides. So this actually you are viewing from the right lateral view. Just consider these are the ureters from which they are coming, and just they are obliterating the bladder orifice. So these are the right and the left ureters. So you are seeing this from the right side. So this, consider this is your right ureter and this is your left ureter. So from the right lateral view you can see this will be the inferior lateral surface because it is inferior, and from lateral this will be the upper part, so superior surface, and apex will be just posterior to your pubic symphysis. So just pubic symphysis will be like this, okay, like this, and just back to that the apex will be attaching in the upper part, as I told you. Clear? And neck will be just below. So neck part will be below, where your actually inferior part and the base will be joining, or the base, that is the posterior surface, will be joining, and this angle is actually called as inferior angle. Now from the inferior angle your urethra begins, and this area where the inferior angle is formed is called as the neck of the bladder. So it is actually on the inferior surface. Okay, so this neck is actually present on the inferior surface from where actually your urethra originates. Now in the case of base, that is the posterior surface, will be just present behind this. So this diagram you can see from the lateral side you will see this. So base will be just present here. So this aspect will be the base of the bladder. Okay, and from the sides will be the inferior lateral surface here, and upper will be the superior surface. Okay, so this is actually a tetrahedral shape. This is the cadaveric form of the diagram which you will see on the cadaver when the bladder is empty actually. So that shape is tetrahedral shape. So you can see this tetrahedral shape, 4 sides. okay, and avoid when the bladder is full. So the superior lateral angle is the angle from where the ureter actually give rise, so superior part and the lateral part, and the upper part is directed toward posterior inferior toward the rectum. So the base is actually directed towards the rectum in the previous diagram as I shown you. So the posterior part of the bladder will be directed towards the rectum. Clear? Now the neck. So neck is the lowest and the most fixed part. So as I told you, the inferior part of the lowest part and the fixed part, okay, and situated where the inferior lateral and the posterior surface of the bladder meet. So from the back side, the posterior surface comes to the inferior side, and here you can see the inferior lateral surface will be meeting here. So this neck is the position where your base, the back surface and the lateral surface will meet towards the downward sides, so here. So from the inferior surface you can see the diagram, I will show you. So from there your actually urethra originates. So it lies actually 3-4 centimeter behind the lower part of the pubic symphysis. So meaning is that the neck is present actually 3 to 4 centimeter behind, that is from the pubic symphysis. So this is the pubic symphysis, just consider this joint, and it will be present on the lower margin of the pubic symphysis and 3 to 4 centimeter behind, clear, on the pubic symphysis. So these are the parts and these are the surfaces. You can see superior surface, inferior lateral surface, posterior surface is actually called as fundus or base, neck part, apex part, most anterior part is apex, most posterior part is your base, okay, lateral parts are inferior laterals, and neck is present on the inferior side. So one more diagram I will show you. So this diagram, you can see this diagram. So this is the view from the inferior side. So you can see this, the median umbilical ligament, this from anterior side, this is the posterior surface, you can see as it is written. So this is the inferior view. From the below, when you will see the bladder, it will look like this. So this is the opening, this is the neck actually, and these are the superior lateral position from where the ureter will be arise. So back side of this will be the superior surface, laterally you can see these are the two inferior lateral surfaces, and this is the neck of the bladder from where your urethra is originating, okay. So urethra will originate. So this is the inferior view. Clear this much? So in this diagram also you can see these are the aspects. So these are the anterior aspect will be looked like this. So you can see this is upper surface, these are the lateral surface, this is the apex, this will be the neck view from the anterior aspect, and this is the apex, this is the neck. So this is the view of the bladder when you will see from the anterior side. So this is the lateral view, this diagram is of the lateral view, this is the view of the anterior aspect, and this you will see on from the posterior side, you will only see the base. So this will be the view of the bladder from the posterior. So this is the basic sketch that you can remember. So this will be the anterior aspect, apex, neck, and this sides will be the inferior lateral surface. From upper side you will see superior surface, okay. So this was your bladder anatomy. Next video will be seeing the relations and the ligaments of the bladder. So thank you, do like, share and subscribe the channel.